Welcome to the Intention Now podcast, the show where we sit down with leaders, warriors, and game changers who live with purpose and create real impact. Today's guest is someone who's literally saving lives and restoring hope to those who are struggling, Dr. Eugene Lipov. Dr. Lipov, it's a true honor to have you here. I recently had the privilege of visiting one of your clinics here in the Chicagoland area, and it was an amazing clinic, professional, and it looked like it was very innovative as well.
Thank you so much. Thanks for having me on.
Absolutely. Let's start off with an introduction. Dr. Eugene Lipov is known as the godfather of PTS treatment. Dr. Lipov is a world-renowned physician, researcher, and medical innovation, recognized globally as one of the leading experts in trauma recovery, known as the godfather of PTS treatment. He pioneered the modern Stellate Ganglion Block protocol, a cutting-edge science-backed procedure that has changed thousands of lives, especially among veterans, first responders, and trauma survivors. With more than 30 years of clinical experience, Dr. Lipov has treated across major media outlets, across major media outlets, testified before Congress, partnered with leading institutions to advance the understanding and treatment that PTS, TBI-related symptoms, chronic pain, and trauma-driven psychological responses. He currently serves as the Chief Medical Officer of Stella Center and continues to push the boundaries of medical innovation. His mission is simple: brief relief, restore hope, and give people their lives back. He is also the author of Godshot, as you can see behind my shoulder here. Dr. Lipov, and there it is as well. Dr. Lipov's work is reshaping how the world understands PTS and opening the door to healing to millions. Dr. Lipov, did I miss anything that you would like to add before we dive in?
Well, the only thing I would do is we need to talk about the term PTSD, PTS, and PTSI. That's
okay.
The term. So we can start anywhere you
like.
Let's
dive into it right now. Let's do it. Yeah.
Right.
So is it really so everybody knows it. So some people call it PTS, some people call it PTSD, like a disorder. And then when I met you, it's like I know you were advocating to try to get that changed to a PTSI injury, because it's not good to have that disorder behind it, I think. But if you could dive into it, that'd be great.
Yeah. So everybody at this point heard the term PTSD. So that's a term that was introduced in 1980 in DSM-3, which is Diagnostic Statistical Manual for Psychiatrists, like the Bible of diagnosis.
Okay.
So interesting, the history of it, if I may. Let's go back to the history. So the Romans, 2,000 years ago, used to call it tremble. The first name during the modern era was Civil War. It was called Soldier's Heart.
Okay.
Then it became shell shock, World War I, battle fatigue, World War II, Vietnam syndrome, Vietnam. Right after there was a Chechnya syndrome, was a term that Russians used because the soldiers that came back from Chechnya had the same look as a Vietnam syndrome. Then it became PTSD in 1980, and that it stayed. The problem with the term PTSD is disorder, is it's very stigmatizing.
Yeah.
So if you talk to most soldiers or Marines or any warfighters in the US and elsewhere, they don't want to be broken. They want to if they have a problem, they want to get it fixed and move on, back to the mission. While term disorder is very stigmatizing, and it actually leads to suicides. So the first person who came up with the term was not me. It was Frank Ogberg, very famous psychiatrist. He's known for the term he came up, Stockholm Syndrome. You probably heard that term.
Yes, I have.
So he and Pete Chiarelli, a four-star general who was in charge of Army prevention, suicide prevention in 2013, went to the American Psychiatric Association and went and said, please change the name. Our guys are telling me that they're killing themselves because of the stigma. And APA in their wisdom said no. So Frank now is 87 years old. So he passed this hot potato on to me. So I did a study published it in 2023, based on 3,000 people. I asked them, half were military, half were not. And basically, the question was, what happens if we change the name PTSD to PTSI? So majority said, the stigma will get better, we'll have hope, and will get better care. So I took that report, I went to the American Psychiatric Association, and in order to change the name nowadays, you need to show that the current name produces harm. So I went there in 2024 and they said, no, we're not going to change it. So the bottom line is, when you probably heard many people talk about PTS or PTSD as an invisible wound. Ever heard
Right.
that? Right?
Yep.
So to me, that's really a nonsensical statement because it's invisible if you have the wrong scanner. If you look with your naked eye, you can't see it. But if you have functional MRI that looks inside the brain, or a PET scan or a MEG scan,
Yeah.
advanced scanners, you can actually see it. Also, PTSD occurs in animals also. It's called VPTSD. Quarter of the military dogs that came back from Iraq. Yeah, sorry about that. Quarter of the dogs that came back from Iraq have PTSD or VPTSD.
Okay.
And treated 2 dogs successfully so far with the procedure I've started doing.
Wow, that's amazing. So, what would be the reason the APA does not want to change that if it's causing additional deaths? Aren't they supposed to be an advocate to help people?
You'd think that.
Right. So what would be the reasoning? Somebody going is it going to get their feelings hurt because it's going to change the term that they came up with, or what are we
No,
missing? What are we missing here?
you're asking me to be political. I'm not a political animal.
Okay. All right.
So,
All
I
right.
mean, I can't be too direct about it.
Okay.
I still live in the same pond.
Okay.
But the bottom line, though, is, I mean, you can make your own decision. There is no reason to term something because part of the reason I talked about multiple different names,
Yes.
it's a random, I mean, not random, there is basically a belief structure.
Right. Exactly.
And
Okay.
if you look at DSM, which is the Bible,
Yes.
DSM-1 and DSM-2, being homosexual was considered mental disorder.
Wow.
The point, it's societal perspective,
Okay.
wasn't well received. And shockingly, in DSM-3, they removed that. So it's just a term, right? I mean, a
Right.
term, but the point is biology, since 1980, there was a lot of scientific development, right? We have brand new scanners, we have this, we have that. The point is, it's pointless to keep saying, is this amorphous, non-specific term? You know, people with PTSD or
Right.
PTS or
Yes.
PTSI, right? And they're doubting themselves. Do I really have this? Am I full of shit? Am I real?
Right. Right.
Um,
Do I have a disorder? What's wrong with me? Right.
well, disorder basically to me, disorder is a lifestyle, right?
Right. Right.
It's like you're ugly. Okay, you're ugly forever.
Right.
Okay, not really. It's disorder means to me in medicine, disorder is basically you have different things together and it looks like that.
Okay.
And that's what it's called. The problem if you take that position, there is no real resolution at the end.
Got it. Okay.
The position I take and what Frank took, and that's why he is a very high power psychiatrist, is that if it's a real condition, you should be able to diagnose it, you should be able to replicate an animal model, and you should be able to treat it. Those are 3 requirements. Like if you look at the broken leg, right? If I told you you had a broken leg disorder, what are you going to do with that? I don't know. So look at the current therapeutic. My favorite or least favorite therapeutic for PTSD currently is called exposure therapy, prolonged exposure therapy. It's still being done today.
Okay.
So the way you do it is you show people who had severe trauma the same trauma over and over again, and you think you'll get desensitized to that, like
Oh,
watching a
wow.
scary movie.
Okay.
Me,
Yeah.
let's go to analogy. Let's look at analogy of broken leg, all right? So if somebody has a broken leg, and you put a rucksack on their back of 100 pounds, and you go up and down the mountain, will it heal the leg?
No.
Probably not. It'll probably
Right.
make it worse. And in fact, a lot of people you talk to who've been through this get freaked out by that. Only 20% of people can complete the therapy, if that. And
Wow.
it doesn't work,
Yeah.
right? So if you look at the analogy, right? So now if you look at the X-ray of somebody who has a broken leg as opposed to somebody who doesn't, it's easy to tell the difference. in a brain, amygdala lights up like a candle in somebody who has PTSD. I mean, you need specialized scanners, but they exist.
Right, exactly. Yeah.
Yeah, it's been written forever. The same thing in a dog. If you cut out the amygdala, for example, you cannot give PTSD to a dog.
Wow.
If a human has like a infarct of the amygdala, they cannot develop PTSD because that's a fear side. We know where that is. So the point is, it is real.
Wow.
It
Okay.
exists. It's real. You can measure it. And when there is successful treatment, then the amygdala doesn't light up.
Well,
Point it's biologic. It's real. So at the very least, if people can take away the whole concept that it is a real condition and it can and should be treated successfully using biological methodology, such as Stellate is something I know a lot about. You can also use TMS, which is transmagnetic stimulation, which is electrical, but it's not a weakness of soul and all of that stuff.
right. That's something that actually happened in your life, and there's ways to take care of it. I'm hoping the APA will eventually open their eyes. I mean, if somebody came to me and I was there and saying, hey, this term is causing the stigma for people to additionally kill themselves. I'm hoping that they would say, hey, you know what?
How about if you do? I mean, to me, you and I both are practical people. We live in the
Right.
real. Hope is not a strategy, right? Let me
Right.
give you a strategy. Two
Okay.
things, really simple. If you don't mind putting a website below it, itsptsi.com. Oh,
its.ptsi.com.
itsptsi.com. It's
Got it.
PTSI.
Okay.
Very subtle name, right? If you
Yep.
go on that, you can see all the stuff, John Shirelli, Frank, everything I've been talking about. But there's also a survey. So I'm trying to take as many people's survey as possible.
Okay. Perfect. We'll make sure.
So that's one.
Okay.
Number two, last I checked, you're a Marine, correct, sir?
Yes. Correct.
Okay. So the person who is in charge of the congressional vet section, or the warfighter section for the Congress, is
Okay.
an Marine. He's from Illinois,
Oh, is he really?
100%.
I didn't know that. Okay.
So my plan is this. I want to, now that hopefully all the Washington has stabilized a bit,
Right.
what I would like to do is go there, bring some special forces guys with me, not to beat anybody up, which they can. They can testify about their experiences. And the other side, bring the APA. So I'd like a neutral body just to listen. Who makes more sense, the APA or me? Because I've done everything I could. I filled out the forms. I did the study. I sent it all to them. And it's just a decision. So it'd be nice to have like congressional hearing. Like, what do you think? Who makes more sense? The
Right.
AP
Exactly. Yeah. Present the facts and see. Let them.
with the guys,
decide.
right? I mean, how about here's the guys. There's
Right.
plenty of psychiatrists who would like to change the name. But APA is a very interesting kind of
Yeah.
and DSM committee, they've had some interesting problems recently.
Okay.
Financial
Gotcha.
improprieties and whatever. The bottom line is it's killing people today. And it is reversible today at no cost. There's no cost involved. What's the downside?
Right. Exactly.
You guys a little bruised? Who cares?
Right. Exactly.
I could
Okay.
care less. If you could reach out to that guy, it'd be amazing.
You know what his name is by chance?
I can look him up.
I'll look him up later. That's fine. I'll look
I
him
know
up.
he's a Marine and I know he's from Illinois.
Okay. Perfect. Perfect.
That's all. I mean, you guys
Okay.
are all connected,
Yeah.
right?
Yeah. I'll look it up. Well, thank you for that explanation. I'm looking to dive into more about Stella here a little bit down the road, and I know that's you've actually been doing this for quite a while and saved many lives. So definitely want to get that word out here to everyone that's listening. Let's start off a little bit with your history, if that's okay.
Sure.
So you're here in Chicago, obviously, because I met you. But did you grow up here, and what was your family like?
Well, I'll give you how about let me go from my birth to how I ended up here.
Okay.
So I was born in Ukraine, about 200 miles south of Kiev.
Oh, nice.
It was a neat place to live.
Yeah.
So when I was 6 years old, we moved to Moscow, and we lived in Moscow till 14, and we came to Chicago when I was 14. I've been here ever since. I did undergraduate here at Northwestern Medical School, Northwestern, training at U of I and County. Then I went to Rush, and I did 7 years in Rush as assistant professor, and then I opened up my own private practice. And I've been writing papers in all throughout, and through an interesting set of circumstance, I was able to figure out that stellate ganglion block, it's an injection of a nexus of nerves that controls the fight and flight system from the neck to the brain. It resets PTSD symptoms about 10, 15 minutes. So that's been really a joy to see a lot of people's lives. Now, the reason I was interested in that is because my father was a flyer in World War II, and they used to drop bombs on German ships, which they did not like that.
Right.
So out of the squadron of 10,000 people, 100 made it home. So my dad was one of them. And then he gave PTSD, it's called secondary PTSD, to my mother, who eventually took her life when I was an intern. So I'm very interested in military PTSD, military family PTSD, and children's PTSD, because I'm one of those guys.
Wow. So
So
that
that's why I've been so persistent in trying to get it moving along.
wow. So you have something that that's really resonating with you. What happened in the past is another reason you want to help a lot of people,
Yeah.
right? And you're
Well, I
doing
know what it's like to the family, right? I mean, you
right.
walk around the family where you have, like, my father was very explosive. It's
Okay,
very common in PTSD, right?
got it.
And it's just very hard. And the other concept that PTSD, you can catch PTSD from a loved one, that's a bizarre concept to most
Right.
people. How can you, it's not a cold, but like, for example, when I treat people, occasionally I treat the entire family, which is typically the guy, the wife, and the kids.
Wow.
Because they're all affected, right? And it's like STD. You could fix the guy, the woman still has it, he's going to get it back from her.
Oh, interesting. Wow.
Isn't that
Yeah, 'cause
weird?
if you're around all that negativity all the time, right?
Well, negativity plus the guys feel bad. Look what I did to you. You feel so sad, and she's always reactive. He's trying to help him, and she's like, that's not helping joy feelings in the family structure.
Wow, that's amazing. When did you know you wanted to become a doctor?
Both of my parents were docs, so when I was 6 years old, I was drawing pictures how to cut out cancer. And my father was a chest surgeon, so
Okay.
my first toy that I remember was a chest spreader. It's designed to open up
Yes,
the
I've seen them.
right. You crank it and goes up. That was my toy. So if I was five, I kept myself entertained with that.
There was no question what you wanted to do for the future, which is pretty
Well,
awesome.
actually, when I was in college, I had a choice either to become a biochemist scientist. I was
Okay,
I was really interested in biochemistry or medical school. The problem was being a scientist, you don't get to deal with people, and I like people.
got it. Got it. Perfect. What was the most valuable lesson you have learned since you've been in medicine?
Oh, that's easy. I learned it in a cancer ward, actually. I was a
Okay.
full medical student, and I was hanging out with cancer patients all day long.
Wow.
So you see two types of cancer patients, miserable and the ones who are at peace.
Okay.
So that I was trying to figure out the difference. Difference was people who had no regrets, have done everything they want to do. They apologized to everybody they want to apologize. They had zero regrets.
Wow.
And they're like, it's time to go. Bye-bye now.
Right.
Had regrets, were miserable. And that accelerated their cancer, actually, which is pretty sad.
Interesting. So the people that couldn't let it go and had those grudges.
Well, not necessarily great, but feel bad. Like, for example, right after that, I called up my ex-girlfriend, she was my first girl. I treated her terrible.
Okay.
Had no violence, anything like that. But then
Right, right, right.
I was just not a nice individual to her. So I found her. It took me about a year, and I apologized to her.
Oh
She's
my gosh.
like, why would somebody call? It's thank you, but that's so weird. I said, it's not about you, it's about me. I still feel bad about it.
That's awesome. What was the hardest challenge when you were practicing medicine throughout your career?
Well, that was easy also, unfortunately. So I really want to be a surgeon. I have pretty good hand-eye coordination, and I always enjoy surgery is an amazing field. It's fascinating. So my mother took her life when I was an intern.
Oh man, sorry.
So thank you. So I
How old were
left,
you then?
I was 26,
Man,
26.
holy cow.
Anyway, so I left surgery a year after. I just didn't have the oomph anymore to do
Yeah, I
it,
can imagine.
but it was too hard. And then I went to anesthesia, and anesthesia it was never built. That specialty is great for certain people. I was really good at it, but whew, it's a tough job for me. I'm just not built for that.
Wow.
It's like the surgeons drive the ship, and I have a pretty alpha personality. I was like, I like to drive the ship. As
Right.
an oncologist, at best, you're a second mate. And then sometimes surgeons are not right. And then, I had a lot of surgical training already, and so I knew how it should work. So that was very conflictual. So I'm glad I got out of that and went to pain medicine, which was much better for me.
Gotcha, gotcha. And did your mom suffer from PTSD as well?
Yeah, she had PTSD, depression, anxiety, all of the
Did you get
usual.
it from your dad or?
I think she had genetics of that, but
Okay.
because my father was, he was dramatically, I call it, when I talk to people about PTSD, I call it, do you have a spunky childhood or not? If it was like idyllic, nice, everything is great, definitely not idyllic.
Got it. Got it.
It was spunky,
Yeah, it's kind of interesting. A lot of soft guys have had tough childhoods, which is
but 90% of them,
yeah. Yeah,
almost
back.
everyone. And I
Yeah.
think part of the reason, what I found, the commonality, people who are like high achievers in anything,
Hmm.
usually did not have easy childhood.
Yeah.
I
Okay.
think in
Because they have
order,
that fight in the game. Okay.
yeah, that and the gumption to stay in a game, the persistence. Like my brother calls me BB, brother bulldog.
Okay.
If once I grab onto something, I just don't understand the whole concept of quitting.
Yeah. I'm the same way. I get it.
Well, Marines are not so good at quitting either, from what I. It's not a quality you're good at. I'm sorry. Let's see what the dog is doing.
Yeah, no problem. So another experience I wanted to ask you about. I know that you've lectured many places, traveled the world. You have actually clinics in different parts of the world as well. What's one of the most impactful experience while traveling worldwide that you've had?
You ask interesting questions. So before I got to the PTSD ward, I was developing treatment for hot flashes.
Okay.
So, and I wrote in some major like Lancet Oncology, which is these are number one or number two global publication in medicine, which is a pretty big deal. So they invited me to go speak in Pan Asian Lancet Oncology Conference in Singapore.
Oh, nice.
Right. So I flew in from Chicago into Tokyo.
Okay.
I was coming off the plane, so I called my friend up and I said, I never thought somebody like me coming from Ukraine would be flying first class from Chicago to Singapore to give a speech about article I wrote. It was like, "Ooh, hello.
Oh my God.
Never, never. The chance of that happening it was zero or negative numbers, but nonetheless, it did happen. It was just amazing. And the other place where was the most touching thing I think I've seen. I was giving a speech in New York City for a fundraiser. There was a gentleman I treated. He was from Vietnam.
Okay.
He got shrapnel in his head in Vietnam when he was 19.
Oh
When I
wow.
treated him, he was 70.
Holy cow.
So I do the block, and he cried like a baby for an hour. And then he said, my emotions are back. I feel great. So 5 years later, he came to a fundraiser. And then, he gave very touching speech. It's on YouTube if you want to see it. But
Yeah,
then
definitely want to see it. Yeah.
kids came over and they said, without you, we wouldn't have our father back. Our family has been healed. I pretty much started crying. I was like, there's only so much emotional kind of stuff I can take. I mean, I'm really good at, putting compartments around, it's like I've drawn trauma units, but that was just because it reminds me so much of my family. If
Right.
that would have been done for my dad and my mother, she may could still be alive.
Right. Exactly. Man, that's
That was an overwhelming in a different way. I was in Singapore is overwhelming in one way. This was overwhelming just because I'm an empath and I can feel other people's emotion. This was just an overwhelming amount of emotion.
wow. That's awesome. Thank you. And we're going to ask a little bit more about that, but there's the SGB actually has treatment for other items like you just mentioned. So I want to kind of talk a little bit about some of the other items that works for as well, which if you don't mind, we'll, as soon as we ask you about how you got into it, if you could elaborate into that, that would be great. I'm going to skip this one. What's the biggest lesson you learned from treating so many patients with SGB?
Hope is all important.
Yes.
No hope, there's no reason to be alive. So
Oh,
that's why it's important. That's why the name change is so important. Because if you look at it biologically, you go, hey, I have a broken leg, but maybe there's somebody I can actually fix it.
right, exactly.
If it's doom, the other thing that Stellate a lot of times removes is a feeling of doom, like something horrible is going to happen. I think living with doom is very difficult.
Yeah.
So I
Yeah.
think people underestimate the power of hope.
Yeah, I've seen some videos with some of the patients that you've treated, and it's just like night and day change, which is
You can see
incredible.
the face, right? You can see it in their faces.
So you struggled with PTS yourself, right? And TBI. Did you do the treatment yourself as well?
Not on myself.
Not on yourself. You didn't wind up just grabbing the needle and doing it, looking in the mirror.
That would look good, though. I've had total of two treatments on the right side and two treatments on the left side.
Okay, you have. Okay. And
Absolutely. It
did you
helped me
feel a result right away as well as your
Yeah.
patients?
So what's interesting? So I had suicidal thoughts when I was 6, just
Oh
to give
wow.
you
When you were
something.
wow, that young. Holy
Yeah,
cow.
I've had issues for years.
Okay.
And then so when I saw a psychiatrist, I always felt like I had a cold hand grabbing my heart for years. So I drew
Wow.
pictures of that, whatever. Right after the block, that hand disappeared.
Holy moly. Man, talk about a visual.
Yeah. Yeah.
Wow.
I mean, it's exactly, I could see it very clear. I have a good visual mind, and it's before I had my stellate block done,
Okay.
I had about 10 cardiac evals because I said, I feel like I'm having chest pain. I think I'm going to have a heart attack and die.
Oh wow.
They checked me out. No,
You're
no, but
fine.
it feels like it.
And they all
But,
said it's in your mind, right?
well, not really, because in fact, people with PTSD, the chance of having heart attack is twice as high somebody who doesn't.
Oh, no way. Wow.
SD kills. Oh yeah, absolutely. What it does, you have the heart, right?
Yes. Beating.
Up
Yep.
the way. The blood flow comes from coronary arteries. Sympathetic system, which is fight and flight system that's overacting PTSD, squeezes those arteries. Even they may be open, but they're still squeezed. Eventually, it's going to form sclerosis, which is tightening, and it's going to make a clot in the middle, and that's called a heart attack. Oh
Wow.
yeah. No,
Holy cow.
I was
Talk
well on
about
my way to get, I would have been dead probably, if I didn't get it, I probably would have been dead by 60, 65.
wow. So you're saving lives in different ways as well. I didn't think about that. That's
Yeah.
amazing. Wow.
We rode actually, if you're interested in the other thing is I was able to treat 20 guys from SOF, half were Canadian first tier operators, the other half US.
Okay.
And so like we talked about the guy who is big into longevity. So one of the big longevity tools now is epigenetic clock.
Okay.
You can measure the aging, when you're going to die. You can predict with high certainty death time. So all the cool kids now are measuring the biological clock or aging clock and see if the treatment reverses it. The idea is to reverse it, right? So we were able to demonstrate that the clock was reversed 2.5 years by doing stellates.
Wow. Holy cow. A
Then
lot of
funny.
benefits. Man.
Yeah, yeah. Well, let me tell you another one that, as a man, I think you'll appreciate. So I was watching a video by somebody who was treated, not by me. His name was,
Okay.
and he was special forces. He stepped in IED, blah blah blah. Almost took his leg off. The usual story, unfortunately.
Right.
Anyway, so they show him before the block, and he looks really tense. And his wife was saying, he's really aggressive, some physical stuff, throws me around the room, all that stuff. So they do the block is done. So a month later, she goes, "Oh, I love him. I got my husband back."
Oh, wow.
Interview the guy. You'll like this.
Okay.
Yeah, PTSD is better. I don't care. That's fine. But my equipment's not working. So it turns out, so I wrote a chapter about that. Turns
Okay.
out 85% of guys have sexual dysfunction from PTSD itself. So
Wow.
the way I explain it to men, if you're running from the tiger, you don't want anything sticking out.
Yeah, that's true. That's a good point.
That
Wow.
is, you wouldn't think of that, but I mean, it's like, and his point was, Luke's point was, I'm 35 years old. There's no reason I should have any
Oh,
problems.
he was that young? Holy cow.
35, right. He is, all the pipes everywhere was
Yeah,
open.
everything should be working fine. Yeah,
Right. 35. If it's not working at 35, that's kind of
there's
early
an
to
issue, right? Wow. Holy cow. So after you did the Stella for yourself, were you always into fitness and nutrition the
no,
whole time?
it was always a slog.
Okay. Did you change
Uh,
after that, or
yes,
because you
yes.
like when I
Oh,
met you, you seemed
exercise.
pretty healthy and
Oh, I do. My biological clock is 6 years younger than my stated age.
okay.
Exercise pretty much every day. Um, and I really take care of myself. Part of it, I have a big mission. I want to operate into my 90s.
Wow, that's awesome.
30 more years, that's going to take a lot of maintenance, but I'm going to try. If it's 20 years, I'll live with 20, but my hope is 30.
That's awesome. That's an awesome goal. I love that. Uh, okay, walk us through the story on how you became involved with SGB and how it all started, if you don't mind.
Sure, for sure. So, so SGB, Stellate Ganglion Block, has been around since 1925.
Okay.
So it's an old procedure. First time I ever did it was
Were they
1986.
using it for PTS and TBI back then?
Pain,
For
pain.
pain. Okay.
So the most common use in the United States, in Japan is a little different, but in the United States, the most common use is CRPS, complex regional pain syndrome. It's basically a kind of weird problem. So let's
Okay.
say it crushes the hand, the nerves get hooked up in a weird way, and it starts to swell and burn. It's very painful. It's very uncomfortable. And what you do is you do the injection in the neck. Poof, if you do it early, this pain goes away.
Interesting.
Anybody who has CRPS, if you realize you have it, treat it as soon as you can because the first 3 months is very important. Anyway, so I've known how to do the procedure for a long time. So then in 2001, something like that, I had a patient that came in. She had hot flashes. She had neck
Okay.
pain. I took her from neck pain, burned some nerves, no problem. Anyway, so then she had hot flashes, and I said, "Hey, I don't do hot flashes. It ain't my thing, man." Mm-mm. So
Right,
I
right.
said,
In the wrong doctor for that. Yeah.
I don't do that. That's
Right.
I don't know nothing about birthing no babies. So I sent to my brother, who's an internist, and he's a very smart guy. Anyway, so he tried the usual thing, nothing worked. So he says, you do this stellate thing for the hand sweats and pain and sweating. Why don't you do the block and see if it takes away the hot flashes? And I was like,
Interesting.
no, it won't work. He said, how do you know? I said, there's nobody done it. He says, try it.
Right.
So I did it, took it away, and I forgot about it. She comes back a year later, said, Doc, my hot flashes came back. I said, what do you mean? It worked? She said, yeah, it worked for a year. I was like, what? What are you
Wow.
doing? That's so weird. Anyway, so it worked. So I called up my brother. I said, send me 10 more and I'll try it and see if I can help them. We did it and it worked well. I published the paper. And then Chicago Tribune came by to write an article about me. And I thought, oh, great. More people get treated, all of that. Not quite. Anyway, so this was 2005. So next time you're around, I'll show you the article. It's cute.
Okay. That sounds
I knew
good.
I was in trouble when the first line in Chicago Tribune was Bianca Kennedy, this beautiful breast cancer survivor, was so desperate to get rid of hot flashes, she let Dr. Lipov plunge a 3-inch needle into her neck. That was the first line.
Man, oh man.
And they went to Northwestern where I went to medical school.
Okay.
They went to the OB section and they go, oh, this is not how we train him. This is terrible. Yes, it works, but he doesn't know how it works, so it's garbage. Then they weren't done yet. They went to Rush, where I had more training. They go, oh, this is just terrible. He shouldn't be doing that. This is terrible. Ta 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 ta. So I did not really want to. I remember there was a great saying: "Do not argue with people who have ink by the barrel."
Yeah.
So not get into an argument with Chicago Tribune. So I focused on trying to figure out why it works for hot flashes. So I read about 3,000 papers. There was one paper from Finland where they were clipping, they would put a clip in the chest, the
Okay.
fight or flight nerves in the chest for hand sweats, and they found PTSD stopped. And I was like, what? So I looked up the anatomy. So it turns out this goes here, it goes to the brain. So I called up my brother and I said, hey, send me a PTSD patient, which he had one, which was abused, whatever. He was on his way to be admitted to a psych ward.
Wow.
We did a procedure, gone. He was fine. The weird thing is, 7 years later, Northwestern got a $4 million grant from NIH to study stellate for hot flashes.
Funny how that works, right? It all comes full
What a
circle sometimes.
what a coincidence, right? And then after I published my 2008 paper, I had a guy calling, his name Dr. Mulvaney. He's a very good doc from Walter Reed.
Okay.
He said, is this complete bullshit or is that real? I said, it's real. Here's the paper. He replicated in 2 seals, and he published the paper on 2 patients in 2010. And
Wow.
that's how I got into the military. And then I've been treating military, and he's been treating military. Other people have done it. There's a big study being done in NYU. Hopefully, will be out beginning of next year, which shows that this is real and it changes the brain. This has functional MRI, and we had an amazing couple give us significant amount of cash to run a study like that.
Oh, wow. That's
A was
amazing.
supposed to do that study in 2017, and they agreed, yeah, it would be great to do a study, but they never done it. So.
Wow. Can you walk us through how the procedure works and what other symptoms this could be possibly helpful for, please?
So let's start the symptoms, if you don't
Okay.
mind.
Yeah.
Because, the terms are great, not, especially if you're using the wrong terms, if you
Right.
know, 99. But where it works the best is nightmares, sleep dysfunction,
Okay.
impulsivity. By the way, those are 2 things that predict suicide. Bad sleep and impulsivity predict suicidal ideation and action.
That's true.
Right? That's not good, obviously.
Right.
Feeling of doom seems to work well on that. Hypervigilance, like always looking around. Those are pretty much the main ones. I mean, those are main symptoms of PTSD anyway. And the way mechanically it works. So some people want to go to sleep, some don't. Like I went to sleep because I was not going to tell the guy how to do it. That would be pretty uncomfortable for him. For me,
It's like you're doing it wrong. You're doing it wrong.
better this angle, no, that
Yeah,
angle.
exactly.
Not a good idea. Anyway, so you'll either sedation or sedation, lie in the back, clean off the neck. I use ultrasound to find the right targets, and then numb up the skin, and then place a thin needle to the right target. Put some bupivacaine in. Bupivacaine is the same drug as used in pregnancy during childbirth.
Okay.
It's been around forever. That drug is old. And then do the same thing, one more level up, 5 minutes. And then typically people get Horner syndrome, which is droopy eye. The eye droops, it's red, the pupil is small. That's normal. It's supposed to happen when you numb up the nerve. And that's,
For a period of time, short period of time that happens?
yeah, that lasts about 8 hours.
8 hours. Okay, got it.
But as far as the result, a lot of times people feel markedly better right after, which is like we're talking 5, 10 minutes. And it can last for months or years.
Wow, that's incredible. So a lot of people, I'm sure they're, audience listening, it's like, how could something that goes in my neck affect my brain? You explained it a little bit. Can you go a little bit more thorough into that?
Yeah, of course. That was when I was in doctor show that the doctors go around and they're like, not a clue. What
How
do
can
you
that be? Yeah, that's like, yeah, yeah.
Well, let me give you a couple of pieces of anatomical knowledge.
Okay,
Number one, fight and flight nerves or sympathetic nerves start in the brain, go down spinal cord, and go out the toes, right? Some of it goes double loops back, goes back to the brain to the amygdala. So,
okay,
in fact, one of the ways the neuroscience guys figure out how the nerves are connected, they label a rabies virus, not in a human, in a rat.
okay,
Inject it into stellate, and I see where does the virus go. There is a direct connection to amygdala. Amygdala is a fear center. So
Interesting.
when I'm blocking this, it changes here. That's why,
Wow.
because there's a direct connection from here to the brain.
Okay, got it. So that's how the block is taking action right there and
Right.
doesn't go to the
Where
brain.
you need it, which is
Okay,
amygdala.
that makes sense. And can you tell us a couple success stories that you had? How many people have you treated as well?
I don't know, over 4,000 probably.
Wow.
As far as, here's my favorite success story, actually.
Okay.
It was patient number 2. Patient number 1 is I told you about the robbery.
Okay.
Patient number 2 was Iraqi veteran from Peoria. His name is Jason Brown.
Okay.
So there are videos on my YouTube channel and others that he made. Anyway, so he was patrolling with his squad in Baghdad.
Got it.
And then a kid laden with explosive was sent to take the squad out. So he shoots the child. Piece of the child hit him.
Oh man. Okay.
He comes home, horrible PTSD, tried to kill his wife 3 times.
Wow.
So his employer was a son of my patient.
Okay.
So he was talking to his dad, and he said, "Do you think you can help him?" I said, "Bring him and see what happens." So we do the block. 5 minutes later, he said, "I remember what happened, but it's no longer this bloody mess." And as far as I know, 15, 20 years later, he's still doing well. He's had
Wow.
two. He had one, then he saw fireworks that flipped him back a little bit. He had another one, and he's still been doing well as far as I know.
Wow. That's amazing. And the great thing I think about the procedure is most people see a result right away, right? And then sometimes you may
It is,
have to do
it
one
is,
or one or two sides, I think you said before.
right, right. So a lot of times we'll do right and left side. It depends how people do. If they feel great after one, we stop, obviously.
Right.
But the significant change can happen almost immediately. And sometimes you need to, after people sleep, they see more how they're doing. Sometimes it's not as obvious. The success rate, I would say, is 80%, give or
Wow.
take.
That's huge.
And a lot of times when people go, well, I'm not sure, I think I'm better. It's like you ask the wives, they go, you kidding me? The kids love you again. You're not cranky asshole.
I
You can,
love you again.
yeah, I love you again. We can have sex again. Hello. Yeah, there was a change. Hello. Hello.
Wow. Why? Wow. That's
So if people are ever in doubt, you can ask the spouses.
okay.
They know.
Perfect. Perfect. And how many clinics do you guys have? You said?
Stella. So Stella Center has, I think, 24 clinics in US.
Okay.
We have 3 in Australia, and I think we have 1 in Israel.
Got it. Got it. And you qualify everyone, make sure that they're qualified because I'm sure there's other people because you said earlier that somebody else did a
Oh yeah.
procedure on somebody else, right? So I'm sure they're not
Yeah,
every procedure
absolutely.
is the same, right?
Yeah, so I mean, hopefully the reason to come to us is we don't just do the block, right? We have more of a comprehensive approach. We have psychologists, psychiatrists, all of that. We also do TMS, we do ketamine, we do other things. And yeah, so, some people I had to fire because they weren't doing a great job.
Okay. Got
And
it.
also it depends. I mean, there's a whole range of people doing stellates now. Blind, which people like basically palpation, that should not be. Not in people are still doing it.
Wow.
Video, actually, in fact, I reported one guy who really had no reason. I mean, he was a chiropractic physician. He had no business doing that.
Holy cow.
Yeah, I was not thrilled with that. X-ray is still used. I used X-ray for 30 years, but I think ultrasound is better.
Okay.
And then, we also, if there are problems, obviously, that's my job, is to troubleshoot, see what's going on, how to fix it. And we publish, we present, we do, it's like we're a mental health environment. So Stellate is only one of things, but, it started as a Stellate. So that's something I know a lot about. But we have like a chief psychiatric officer. He's a Harvard trained guy in Boston. So, it's a pretty meaningful company. I
So
hope so.
can people get in there pretty quickly if they want to make an appointment?
Yeah, I think so. I mean,
And what's the cost per injection?
I think we charge about $900 per side.
Wow, that's pretty affordable.
I don't think it's horrible. Exactly. And
That's
then that
no,
includes,
that's affordable. I said, yeah.
thank you. It includes evaluation, follow up, right, procedure, all of that.
Wow.
I mean, you're not getting nickel and dimed.
Right.
Uh, but we've had some pretty amazing results. I mean, I'm very proud of how many people we've helped and what we've been able to achieve.
That's awesome. I think other thing I've heard as well is there's a lot of different therapies that I've talked to other people that I've had on as guests, and it seems like 9 times out of 10, most people wind up saying, "Hey, the therapy I did, I didn't have to take the drugs anymore." Right? It's like which is incredible, right?
Great.
Because I just recently had a friend a couple weeks ago was on Zoloft, was drinking, got miserable, took a gun out, ready to do the deed, and just luckily he didn't, but he did discharge it in the house, which was not good. So but I think it's
It's okay now, hopefully.
yeah, he's working through stuff. He's working through stuff. So yeah. Yeah, I'm talking to him almost daily now, so making sure he's all right.
I mean, what is the question is, why do people take their lives, right? So
Right.
let me give you, I've thought about that for a few years, you can imagine. So part of what people do, like we interviewed one guy who attempted suicide but survived.
Okay.
He said he wanted to die for a little bit, meaning it was so painful for him to live, right? It's so painful, so hard to live. That's why he was thinking of doing it. He really didn't want to die, but he just wanted to kind of get out of all this misery. And that's where stellate, the good thing about what we do, stellate ganglion block works, as you said, almost immediately. The compliance is pretty 100%. If you're taking the pill, it takes 3 or 4 months to work, and most other things are not fast. So stellate works very rapidly, and it reduces this misery. And if you can get some sleep, everything looks much better.
And I think the great thing is no side effects, right? Like traditional medicine.
Well, there's always side effects.
Okay, there is. Okay.
Yeah, of course. It's still a procedure, right? I still have to pierce the skin.
Okay, got it.
So there was one study done in Germany in 1992, and they were looking at possible side effects.
Okay.
45,000 stellate ganglion blocks were done. Nobody died. Nice beginning.
That's a good plus.
Yeah, it's a good plus. Now they were doing it C7, which is lower. I do it at
Okay.
6, which everybody knows it's safer. It's pretty well known. Anyway, so in Germany, this is before X-ray, before ultrasound, so no guidance. They just
Okay.
did it by palpation. And they found 11 people had seizures, and they had 9 people had pneumothorax, which air in the lung, a couple allergic reactions.
Okay.
Point is, you can deal with those things. And if you compare it against the suicide epidemic we're suffering, those numbers are trivial. And
Yeah.
it does depend on practitioner, right? I mean, you have to know how to do it. It's operator
Exactly.
right? So, like the guy who was chiropractic physician doing it blind, that does not count. It should be by people who know what they're doing.
Exactly. Exactly. Does insurance cover this at all?
Not at this point.
We need to work for the VA to cover this. But anyway, does insurance cover it?
Typically, no.
No. Okay.
Some VAs do offer it, like Heinz VA does offer it.
Oh, Heinz VA does offer it, but is it going through you?
No, 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 no. There is a doc there which I met. He's a psychiatrist and he's doing those blocks. He's a nice man.
Okay,
I
gotcha.
don't know how many people he does per day. I don't know. It's not it's not readily available through the VA, shall we say.
Okay, gotcha,
There
gotcha.
were 3 bills people are trying to pass about that unsuccessfully. That still it should be available for anybody who wants it, but not at this point.
It'd be great if they could just refer them to your clinic. That would be great,
I've tried.
right? Okay.
It
All
doesn't
right.
work like that.
I'll work on that in the next couple of weeks. We'll circle back.
That'd be
Uh,
great. Of course.
so let's talk about your book. It's coming out early next year, right? The God Shot, which is an interesting title. Tell us about the title and tell us
Yeah.
more about the book. It sounds awesome.
Well, thank
definitely
you.
gonna
First of
work.
all, it's a book of hope.
Okay.
It's possible to get better. It also teaches you, and the lady who wrote it, Lauren Angeldi,
Yes, yes.
she's an amazing writer. She's just,
Okay.
and she was able to take sciencey stuff, combine it with humor, and actually make it fun to read. And it's
Okay.
not long, but it's certainly packed with a lot of solid information. It's like I write medical things, so I have to be pretty accurate. Can't make the stuff up. The
Right,
last
exactly.
chapter is a chapter of hope. So the point is, it's possible to diagnose PTSD, it's possible to treat it. That's the key. And recognition is a big part, right? Changing the name and talking about secondary PTSD, that dogs can get PTSD. All of that is in that book. So, some of the pretty scary stories in there, but the endings are good.
That's awesome.
Uh, Anyway, you're gonna like the name where the name came from.
Okay.
So I treated a Marine. Those Marines are everywhere. Huh, they're just all over the place.
And they never quit, like you
No,
said.
they don't. Anyway, so one of his buddies had a stellate by somebody else. And
Okay.
called stellate the gut shot because it changed his life.
Wow. Okay.
So he said, well, I like, we call it the gut shot. So then in 2016, Playboy wanted to do an expose about Stellate Ganglion Block.
Okay.
They contracted a guy, Matt, who was a army lieutenant in Iraq. So he wrote a whole expose about it, and it was called The Gut Shot. So if you want
Wow.
to see that article, which is hilarious in
Okay. Yeah.
all places,
I got
it's thegutshotbook.com is the website.
gotchabook.com. Okay.
You can
Perfect.
pre-order the book if you like. It's going to be available February 17th. I've gotten translated into Spanish, so it'll be available in Spanish version
Oh,
by
nice. Okay.
February 12th.
Is it going to be available on Audible with your voice as well?
Absolutely not this voice. No. Well, I don't know. The publishers have not quite decided on who's going to read it yet, but they asked me
Okay.
if I wanted to read. I said absolutely not. I'm not a voice actor. Um, However, the Spanish book, I can tell you, I picked the voice actor there.
Okay.
Beautiful voice.
Really? Okay. Nice.
Beautiful. I'll
You,
tell you. Go ahead.
no, go ahead. Go ahead. Tell good.
Find it kind of funny story how AI plays into our lives, right?
Yes, exactly.
So I don't speak Spanish at
Okay.
all. We have a home in Mexico, but I can maybe speak 5, 6 words. Kind of on a good day, maybe.
You got the food down, I'm sure.
Yeah,
Yeah,
maybe. Muy
maybe. Okay.
poquito, muy grande poquito. Anyway, but what's interesting is, so I have a podcast. I think
Correct.
Brain, Hope, Reality. And then I did it for Day of the Dead
Okay.
from Mexico.
Oh, wow. Okay.
So with this PhD, an amazing woman. She's a psychology PTSD, brilliant woman. Anyway, so there is a software you can get, which is cheap, that'll translate your language into Spanish and do the dubbing of your lips. So it looks like I'm speaking Spanish.
That's amazing.
Hilarious. Every time I see that, that is so funny to me. Isn't that cute? So I'm trying to
I'm
grab
gonna
the
have to
stuff.
watch that just to listen to it and see it. It's gonna be
Good.
awesome. Yeah.
Yeah. I'll text you at least one piece of it this morning.
Okay, that'd be great. That'd be great. So if there's veterans listening right now, or anyone that's suffering, right? Because this works not just for veterans, I know that you said you've done dogs, and you also done first responders as well, right?
Absolutely.
They're fighting the visible battle. If you could sit face to face to them, what would you say to them?
Don't give up hope. Keep trying. You don't have to live in misery. Doesn't have to be me treating it, but there are other treatments like ketamine could be extremely effective and life-saving because it's like somebody's suicidal, they don't know what to do themselves. The other thing that I think I'm a big believer in, by the way, the people talk about alcohol abuse disorder, right?
Yes.
I think it's complete bullshit
Yeah.
perspective. All it is, it's a symptom. Like I've treated a SEAL, a lieutenant, and
Okay.
he was drinking a liter a day of vodka,
Holy
10
cow.
years.
Wow.
Quite the man, huh? Anyway, we do the block. stops drinking like that, no DTs, and he did great. The point is a symptom. They're trying to keep their trouble at bay by alcohol, but you can't function on alcohol. Plus, it's going to kill your liver. It'll do all the other stuff. The point is fix the underlying problem, the root cause. If you fix the root cause, other things will get better. The drugs, most of the drugs, there are some really good ones, but not that many.
Right.
They're not helping you. I mean, it's like look for something. If it hasn't worked, change something.
Exactly.
Don't
I
give
think
up.
a lot of soft Marines, whatever, we think we could handle it. We could do it ourselves, right? So they try to find some kind of cure. It's like whether it's drinking or drugs, whatever. It's like
Yeah.
I could take care of this myself, but definitely you need to find the right solutions. Now, like like Dr. Lipov was saying, there's so many different therapies out there, and he's having huge success for many people. So
It worked very well. Also, Ibogaine can do it in this country, but as soft guys fly to Mexico a lot to get Ibogaine.
yes,
Addiction, it works really well. What I'm finding is some of the people who've had Ibogaine and I treated, they still have sleep disorders. The
okay,
symptoms.
got it.
But if somebody is addicted and there's nothing to do, I've been through 5 addiction clinics, stop. Do something different. 12-step is great, but your monkey is still on your back.
Right, exactly.
Monkey may be smaller, but it's still on your back. They still want to use the drug of your choice. I think Ibogaine and other drugs are possible to treat it very differently, right? Just be careful though. Do not, my caution to tell Ibogaine, it can kill you. The way to predict, like for example, they're doing a study in Stanford. It's very clear what you got to do. Magnesium drips and make sure it's a monitored setting. Do not do it in a cave. Don't do it at home. Somebody's sleeping, you begin, United States. I don't know where it's going to be. Do it in a reputable clinic. But the point is there are other options besides conventional therapeutic. Conventional therapeutics together, psychotherapy, the gold standard, plus pharmaceuticals, 40% success rate
Interesting.
with 35%. And that's from Dr. Hoag, who was a colonel of psychiatry in Walter Reed. He knows.
Wow.
It's not my number, it's his number.
Wow.
That
Yeah, I had Dr. Chris Free on, which
Chris Frey. Oh,
and
great guy.
he promoted the Stellate Ganglion the most. He goes, Dave, this is the best one out there. He goes, and I think what I really love about it, you don't have to fly anywhere. You could get it here in the U.S., right?
Yeah.
It's pretty fast and it's pretty quick procedure, right? It's
Well,
not
many
very
people come in, like I think 70% of people I treat from out of town, they come in Wednesday and they leave Friday night or Saturday.
yeah.
Yeah, it's not a major thing. And we have my staff is better than anywhere in the globe, I think.
And it's a beautiful clinic. I got a chance to visit it, so you're going to be treated right. The cost is not very much, right? And the success rate is really up there. So it's like, yeah, I definitely encourage anyone that's listening today to check out the website more and get more details because it's definitely powerful. I'm gonna be talking to more people about this. So thank you for that. The book is called Gotcha. How important is faith to you, Doctor?
Quite a bit. I'll tell you the reason. I was
Okay.
really, if you think about it, I was born in Soviet Union.
Yes.
That's not very religious.
Okay.
They believe that um, the saying was religion is opium for the masses. That was their perspective.
Okay.
So when I was on right before I started residency, my parents gave me a trip as a celebration. I went to Puerto Vallarta. I
Oh,
got
nice.
my propeller blade,
Okay. Oh,
lost half my blood volume, ended up in a tunnel talking to people around God. So, I had an out-of-body experience.
wow.
It's very difficult not to have faith if you had out-of-body experience.
Okay.
So, like my son gives me grief. He says, it's like, you're supposed to be a scientist. Why are you talking about God? It's like, I don't know. I'm pretty comfortable he's out there.
Right.
So,
Exactly.
I've survived some stuff I shouldn't have survived. And I think he was just trying to guide me. So I have a lot of faith And I think having done clinical medicine, not everything can be explained by conventional science.
That's
Just
true.
you can't. There's certain things that people survive that walk off the table. They should have died 10 times over. It's just not their time. It just doesn't have enough explanation for me.
I agree. I agree 100%.
So have an out of body experience made me very spiritual, I think.
Wow. Holy moly. Yeah, it's definitely something that has helped many people as well to get their
Absolutely.
life in order, having
I
that
think
faith.
having faith is really helpful.
Right.
Having no faith, it's a harder way to go, at least for me.
Yeah. For me, it's really easy. All I got to do is look around, right? It's like, who created all this? That it just didn't happen, right? So,
Well, the question is, what do you focus on, right? Some of the other stuff I look at is like, really, who created that?
right.
Really? This? This? Child abuse?
That's true.
Read this?
Right.
So, but,
Do you,
I've had to resolve some of that. Because when you do trauma, you get to see the worst part of society. When you're in battle,
well, you were at Cook County, right? You said?
I used to do trauma for two years there.
Wow. I can't even
I've
imagine what you
lost
saw there.
children. Yeah, I've lost children who were 10-month old who was sexually abused. I mean,
Oh my gosh.
how does that work, right? I mean,
Yeah.
hard to
Well,
maintain faith with that. I got to tell. When you see that's pretty hard. But
yeah.
having tunnel,
You
I don't
got
have.
you got faith and you got evil, right?
Yeah, exactly. Well,
So
you
that's
gotta know good, bad. Well, I like to be in a good part. I'd like to help.
exactly. Do you do anything to kind of keep God in the center of your life at all?
Not, I mean, like attending
Just kind of
church.
believe. Okay.
No, I think I feel very held every moment of the day. That helps me a lot.
Okay. Perfect.
Yeah.
Awesome. Awesome.
I got having been, I don't think you can meet anyone who had been in the tunnel who's not changed in that direction. I don't
Wow.
think it's possible. If you have any brain at all, I mean, that is an amazingly powerful transformation that lasts the rest of your days.
That probably stuck with you every day, right?
Absolutely. It has. Without it, I don't think I would have survived through a lot of
How long were you out?
probably a minute because I was
Okay.
sinking, right? I was drowning.
Oh wow.
Then got a load of the rest of the story. So the guy hits me, right? He was drunk,
Oh man.
blood all over. So I come to, and he's looking at me bleed to death. So I crawl in the boat. I had medical training by that point, put pressure on bleeding wounds, and that's why I survived. I knew what to do about the blood.
Wow. Holy moly. Thank God you saved yourself.
Well, he gave me enough training so I could. And it's funny, when I was in the tunnel, it was the most comfortable thing I have ever felt in my life. It was like unbelievable. And then all I hear it's like it's not your time. And then I'm struggling to come up for air. And then entertainment started.
My gosh. That that it's when it's like you can't describe stuff unless people feel it sometimes, right? So I'm sure still even with the Stella, right? So that's why I encourage people to try it at least. Um, how can people find success if they're unsure of their purpose and direction?
That's a good question. Um, I think it depends how you define success, first of all.
Yes,
And
correct.
I'm not trying to sidestep it.
No, no, you're good.
For me, I have a very strong purpose and direction, obviously, because I can do something that saves people's lives. And every time I help somebody and they say, you did great, I feel my mother patting me on the back saying, you've done something good. I mean, it's like
Nice.
I live in paradise daily. So that part is great. I think in general, I think if people are less selfish, if you're not sure what to do, fake it till you make it.
Okay.
Go help somebody learn how to read. Go to build the home habitats for people. Help, like I used to volunteer to help dog vaccinations. There's always something to do because a lot of times it's hard to start, right? I think the hard thing to do is, well, I don't feel like it. I'm too tired. My video game's not going to play itself. 10 hours of video games are marvelous, but all it's doing, it's rotting your brain. It doesn't help you. You need
Exactly.
human being, you need to interact with other human beings, right? You know, take class, learn something new, but I think try. Throw things enough things at the wall, something will resonate with you. And then, but the problem is when people are stressed, it's hard to leave the house.
That's
And it's
true.
scary, right? I mean, especially and press, I think social media makes it harder. So here's the advice I gave to everyone. By the way, during COVID, people would have
Oh,
me.
that's true. Yeah.
They said, right, how do you survive through that? So the next version of it is how do you survive through our interesting times? We live certainly fascinating times, right?
Absolutely. Yeah.
Very whatever. So here's basic principles. Number one, allow yourself only 1 hour of social media a day. Not every day. I know it's cute to watch cute kittens, but 10 hours of cute kittens, cute dogs didn't do anything useful. All you've done is gotten weaker. That didn't do anything useful, right? So limit social media 1 hour per day. No matter how scary its headline is, if they're going to drop the bomb, you'll know it, you'll burn down. Short of that, who cares?
Right.
Right?
Yep. Nothing we can do about it. Right.
Non-election, it doesn't matter. You don't need every minute of the day information. That's crazy. Get some sunlight. The more sunlight you get, the better you're going to sleep. The better you sleep, the more happy you're going to feel. That's really important. Do some exercise. Well, I don't have enough money for the gym. Do a plank at home. Do some push-ups. Hello. You don't need any equipment. Or if you're too lazy to do
Some of
that,
those
go
straps,
for a
right?
walk.
Right.
Go for a walk.
There you
But
go.
yeah, plank is really great because it gets your entire facial planes, the entire body toned, right? And push-ups,
There
right?
you go.
Can't do the push-up. I'm too weak. All right. Stand on your knees. Do those push-ups.
Oh, there
All
you
right.
go.
You have a chair? Get in and out of the chair. Get the quad stronger. Do something that produces endorphin, makes you happier. Motion leads to motion, like a motion. Because if all you're doing is nowadays with Uber Eats and all of this,
Yeah, I
you
can't
don't
believe
leave the
people use
house
it.
for anything.
Yeah.
I know of people who died playing video games being 700 pounds. They
Wow.
never moved out of their chair. Okay, if you want to live that kind of life, go ahead. Stink and not being able to walk, that's not good. That's not a life. Get out, volunteer. I think volunteering is great. Having a purpose. I think you need a purpose. I think certain people go to church, synagogues, whatever. But the point is be with people. I think that's key. If you isolate, human beings don't do well in isolation at all. But social media, cut it down, turn off the alerts, every bing a ling a ding. You're like, I see people like they can't even speak to you. I have people trying to talk to me and they're on the phone. I was like, well, first of all, it's rude as hell. It's like,
Right. Exactly. That's
the
true.
phone goes down, put it away. And it's like they're like, uh-huh. Oh, divided attention, I can do multitask bullshit. That's been unproven. You
Right.
cannot do human beings, no, they cannot do multitasking. They do everything badly. That's
That's
true.
true.
They can do
Yeah.
that. And then when you're on the phone and driving is the same as being DUI. There's no difference. The same
Yeah.
response time, right?
I see that all the time on the road.
Yeah, I see it's like, well, hello.
You
So
know,
I
it's
spend
crazy.
more time looking at what they're doing instead of what I'm going.
Especially nowadays when people are at the red light, you gotta honk at them to move, you know?
Yeah. I'd rather take that than somebody on the highway at 90 miles per hour,
That's true.
driving with their legs, typing in the phone, and eating a donut. Oh, that's my favorite.
Oh
That's
my
like,
God.
whoa, I'm scared now. Now I'm scared.
All right. We got a couple questions before we start wrapping up here,
Yes,
Doctor. It's
sir.
been a pleasure so far. If you were 20 years old today, what path would you take? Would you take something differently, or would you do something differently at 20?
If I was 20 years old right now or 20 years old then,
Knowing what you know. Yeah.
now medicine would be way too hard. I would go into biochemistry.
Okay.
Medicine, at least in this country, medicine
Big
uh,
change.
is changed and not in a good way. It's destroyed. You cannot really take care of patients because everybody is forcing you to behave a certain way. The last time I worked in a hospital, I was a head of pain clinic.
Okay.
A company, EMR, it's called Epic.
Yeah. Yeah. Yep.
As I was literally when I left, I was literally dancing and I was using some profanities, which I found amusing, which I'm not going to do now. But what you could do is epic. It was not an epic software system.
Electronic
And then,
medical records. Yeah. From familiar.
but the point is, you spend all your time typing instead of talking to the patient. It should be patient, and it's very hard to be a doctor now. But I think I'd be a researcher right now in biochemistry, and maybe in neuroscience.
Perfect. So we talked a little bit about some goals. Any other goals that you have moving forward? I know that you want to practice to your 90. We got to talk to the congressman. We got to try to change the term to PTSI. Anything else that we missed?
Well, I have a couple other goals. I would like
Okay.
to open other offices. I've talked to some countries in Middle East,
Okay.
talked to people in Greece, England. I'd like to spread it out to many other places. I also want to write a number of other books. It's going to be, I just discussed with the writer, the next book in the series will be called The God Shot, the Family Edition.
Oh, love it. Okay.
Because you understand why I'm interested in Family Edition.
Right. Exactly. Yeah. I mean, yeah.
And then the next one after that is going to be children.
Okay.
Because most people who do procedures really do not like to work with children. Children are hard, right? But I like children. I have a lot of experience doing like open heart cranial surgery in children. So
wow.
I'm used to it. And our office is set up, and that's a very big problem, especially adopted children. They are aggressive, they're hard to deal with, and they play some medications, which are horrible.
Right.
Gain weight. The other part is like, if, for example, if you look at the antidepressant drugs for children, there is in big letters, it said increases suicide rate in teenagers.
How can you give that to a kid?
They do.
Logically, common sense. It's like, hold
But
on,
they do.
let me try to give my kid good food, but let me give him a drug that might kill him.
But they
Like,
do.
how can they
Well,
even prescribe that? It drives me crazy.
let me give you some numbers. So in US, this is the highest rate in suicide since 1941.
Wow.
1941 was World War II started, right? Teenage suicide is high as it's ever been, as far as I know. Preteen suicide rate is before 10 years old. It's climbing like crazy. Think what that's saying about our society and where we are at mental health wise.
And you said you've treated kids as young as 8 years old at the clinic, right? So
Yes.
definitely.
So yeah. So actually, we're going to present that data in I think 4 months.
Okay.
Point is, I have a lot of experience, and I published on that a while ago.
Okay.
The point is, if you look at the family, when you have, there's a saying, you're only as happy as your least happy child, right? So if you have somebody who is really spunky, the whole family is very unhappy and very stressed. And then the other children are stressed. Parents are stressed. That leads to divorce. It's a mess. It's a complete mess.
All you need is one cog in the wheel and it breaks apart.
You got it.
Right.
So that's why I like treating those guys, because very few people even think about it, or people like myself don't really want to deal with it.
Yeah, I love that. That's awesome because kids are so important, right? Get it.
Oh, supposed to be as our future, isn't that the story? Or is it the robotics?
What do you need to expand nationwide? You just need more funding or more contacts?
I don't know. I don't run that part of the company. I'm just
okay. I thought you said you were okay. So got it. Okay.
It's like, but as far as international, it depends connections.
Okay.
Yeah.
All right.
It's the great thing about what the model that we use. It doesn't take that much money. You need to find the right people in the right places with the right staff.
Got it. Okay.
But we don't have a lot of equipment. We don't need to buy buildings. We don't need to do all of that, which makes it. But I think as it becomes more accepted, other people will do it. And my fear is that there'll be bad players, which will make
standard. Yeah.
Right. And that's the thing. And that's why I want to be able to control who does it too.
Yeah.
To a certain extent that I can't do everything.
Right. Right. Exactly. You can't clone yourself yet, unfortunately.
I think the world's ready for two of me. I don't think so. I don't think I'm ready for
Probably be arguing against each other. What are you doing? What are you doing?
You know, consider saying, "Oh, you're so good." Oh, no, no, you're better. No, 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 you're so good.
For everyone, we got one last question before we wrap
Yes.
up here. Everyone listening today, go to Dr. Lipov's website, StellaMentalHealth.com. Stella is also on all major social media platforms, YouTube as well. I think you mentioned. So go follow and stay connected with him. Definitely keep researching this, and
Well,
more
if I may,
important.
a couple other things.
Yes, go ahead.
My personal website is drugenelipov.com.
Okay,
That's all the publications. So if you want to read the stuff I've been talking about, everything is there. You can read it. You don't have to look for it.
perfect.
So you can also follow my Instagram, Dr. Eugene Lipov, and then TikTok, Dr. Eugene Lipov, and Facebook, Dr. Eugene Lipov.
Awesome. Perfect. I'll make sure I should put that all in
Thank
the
you.
podcast as well. Uh, kind of ask you something similar, but finally, the last thing I have for you before we start wrapping up, what's the one message you want listeners to walk away with today?
I think what I already said.
Okay.
Have hope. Don't kill yourself. There are effective treatments out there, even though a lot of treatments hasn't worked. Doesn't mean the new ones won't.
I
Number one,
forgot.
right?
Yes, go ahead.
Never too old. It's never too late to start an effective therapeutic. Like I've treated people 80 years old that their lives were transformed. Because
Man.
people go, well, I'm too old, I've had all this stuff. What's interesting, stellate works, the worse the condition is, the better stellate works.
Wow. Holy cow. You don't hear that too often.
No, it's like, oh, you got here too late. Woo!
If you
It's
would have only come 10 years earlier, right? Yeah.
right. This is the opposite, which is really interesting. I
Wow.
don't encourage people to wait though.
Does pretty much, is there any things that make you not qualify for Stella?
Yeah, somebody who is schizophrenic, actively suicidal, so that's no.
Okay.
Physically, if somebody has a bad heart, bad lungs, bleeding disorder,
Okay.
too big. So if somebody has
Yeah.
shoulder earrings, obesity, just physically, I
Can't
can't
get
do
in
it.
there. Yeah.
But short of that, if people are healthy, no. I mean, it's like, keep in mind, this procedure has been done routinely by people like myself since 1925.
Wow. That's amazing.
Like when I was in Congress, one thing I said is that it's not going to grow a tail. We know everything about it, the complications, the. There's nothing that's going to be weird. So new drugs, sometimes you get late weird side effects. This will not do it. This drug's been around since 1972.
How long ago was it when you were in front of Congress?
2010. If you want to listen to this, it's on my website. You can listen to my testimony.
Awesome. Thank you.
Yeah, they like Filner, who was presiding there, said, "Well, you sound like you know what you're talking about. Like, how do you know? How do I know you're not full of shit?" It's like I said, the data will prove the day. And guess what? Now it's being proven.
That's awesome. I'm glad it's moving forward. Dr. Lipov, it's been an absolute honor having you on today, sir. Thank you so
Thank
much
you.
for your sacrifice, your leadership, and you continuing to serve to help all the veterans and many people out there by helping people get literally their lives back. So I really appreciate you being on today.
You're very kind. Thank you so much.
For our audience tuning in, share, follow, and subscribe. These stories need to be heard. These lessons can change lives, literally. Stay focused, stay winning. God bless you, and thank you for listening.